Okay, this is Delores. First, I want to have you tell a little bit about your story. You came to see me because of knee problem, because of breathing problem, but you didn't know that I can treat eyes. So tell me about all the improvements since you came to see me.
Okay, I heard Dr. Tong over the radio, and he was talking about a gentleman that he worked with his knees. So I contacted him and came to see him over my knee. The doctors were wanting for me to have knee surgery, and I didn't want to have knee surgery. So anyway, I came to Dr. Tong and of course had wonderful results. I still have not.
From the first treatment, you noticed any difference?
Oh yes, definitely.
First, yeah,
yes,
right. Yeah.
Definitely.
Yeah.
And I still have not had surgery. I come and have treatments regularly, and I actually walk and will do some sprinting up a hill. 5 or 6 times I'll sprint up a little hill and then I walk down. I walk my dog, and whenever I start feeling problems, I'll come and see Dr. Tong.
How about your eye pressure?
My
Or somebody tried to almost ruin your eye with the cataract surgery.
Yes, I had a doctor that did incorrect surgery and actually put a cataract lens in front of my iris instead of the back. I was diagnosed with glaucoma back in 2001 or 2000, and after the cataract surgery, I thought it was the glaucoma that was causing my eyesight to go bad. And it turns out that the surgery that the doctor did ruined my optic nerve, and then another doctor corrected his mistake.
But your vision still no good, right?
Pardon?
But your vision still was no good.
Yeah, I've lost 90% of my vision in my right eye due to that surgery. And of course they corrected it. They got another eye doctor who did the correct surgery and put the lens, but that optic nerve was destroyed. But I have been, just by coincidence, I told Dr. Tong about that, and he said, we'll work on your eyes. And I was at a point that I was having to have reading glasses, and I was having problems with
your
the computer.
Yeah.
Yes. And with my eye, with my injections or with my treatment, I'm not using glasses for the computer anymore. I'm using it for distance. But most importantly is the
eye pressure.
The blood pressure. I have come to him before I see my doctor, and my pressures are normal.
Not your blood pressure, but your eye pressure. Yeah,
yes,
glaucoma pressure.
But
what are they? What are they now?
The last time I went in, I had like 12 on my right eye and 13 or 14 on my left eye.
That's
my good
normal.
eye.
That's normal, yeah.
Right.
And is your eyesight on the left side any better?
It is. It is better. Of course, I have astigmatism that I have to wear glasses for, but my eye doctors actually wanted to do a cataract surgery on my good eye, and they also wanted to do laser surgery, but due to my treatments, I haven't had to go there, and I don't want to do anything
because
to my
it's going to
left
ruin
eye.
you. My treatment going to help you.
Yes.
And before you were getting free treatment every 2 months. That's not enough.
Yeah.
Now you have been coming a few times for like twice a month.
Yes.
Yeah, so that you notice more improvement.
Oh yes, yes.
Yeah. Anything else? The breathing better?
And I have asthma, and I come, and after my treatments for 3 or 4 weeks, I'm breathing better, and when I stay awake, I end up having the problem again.
Because you don't come frequent enough, you got too many problems. Okay?
Yes.
But in any case, everything improved.
Yes.
Let's talk about anything else.
Well, initially when I came to see about my knee, I was also having problems with my neck, and that went away too.
They are all connected, okay? You cannot improve the eye without improving the neck and without improving the knee, so they are all connected, okay? Let's talk about a more interesting problem. I'll call that 30,000 instead of 30 million. Or 30 million instead of 30,000, okay? So your son is in minor league baseball, name is Dave. So let's talk about, he came to us first in 2009 when he was in college. I gave him 3 treatments. Okay, what happened? Oh, he had shoulder problem, arm problem, so you cannot play baseball too well. And then what else? Let's see what else he has. Arm pain, elbow pain, shoulder pain, low back pain, asthma.
Yes.
And neck, yeah. So he had 3 treatments, okay? Tell us his performance in college.
Okay, his freshman year, he wasn't performing very well. And then he injured his shoulder. I told him, I said, let's go see Dr. Tong.
How did he injure it?
He caught a ball or fell and catching a fly ball.
Oh,
Right,
okay,
and,
okay.
And hit his shoulder, he dislocated it. But anyway, he came and had, I believe, 3 treatments.
Yeah, 3 total, yeah.
Yeah. Anyway, he went back, this was his second year, and the first game that they played, this first season game that they played, he hit a home run, and they won like 4-1 or what, I don't remember what the score was. But he brought in 2 of the runs and made a home run. So out of the 4, he was responsible or made the 3. Then he came to see you again in 2013.
Yeah.
And he had also had a shoulder injury then. He got, that year that he came to see him, that year he got voted MVP.
Let's talk about, we always ask patients to fill out an initial treatment report, whether they report any improvement. This is what he said. The improvement, he said yes. What improved? Breathing. Okay. How did the improvement from our treatment compare with those from previous therapy? Results were much quicker and better.
Correct. And that, I believe, was in 2009.
2009, yeah, okay, the first time, okay.
Yes.
Anything else? Did coach say anything about his performance?
He wrote an article about him, and that was also a situation where he improved with his focusing.
Okay, that's important. We're going to talk about that, okay? Yeah.
Yeah, and that's, I think, one of, it's a real mental game.
Yes.
It's really...
Any game is a mental game.
Yeah.
Any professional game is a mental game. And you got to take fear out of that equation. Yeah, you cannot be professional when you have any trepidation or hesitation about hitting the ball, about putting the ball in the basketball hoop, and so forth, okay?
Yes.
So they did wrote an article on him, right?
Yes, they did. And when he came, I believe, to see you in 2013,
Yeah.
when he went back, he
Yeah.
did very, very well.
How did he
also.
do?
Yes, and there was an article actually written where he was probably one of the best hitters, unknown best hitters.
Unknown best hitter, yeah.
Yeah, and I have an article that was written about that.
Oh.
So I'm, encouraging him because I think he's been brainwashed by someone,
Yeah.
that this isn't, what caused him to improve. And I believe it is. And here I have proof because I want to show him that.
Get this date and go back and then match with the
verify
date how he was performing.
Yes.
Okay. Let me explain in this case. Okay, it has a lot to do with fear.
Yes.
The kidney help the lung to breathe. So when you have asthma, both the lung and the kidney are weak. Okay, the kidney controls fear. So when people are suddenly get scared, they pee in their pants. That's not a coincidence. Okay.
Yeah.
And then he also have problem remembering that he was here. Okay, that is terrible for athlete at this age. Okay, now kidney also control the brain, control the marrow, and the brain in Chinese medicine is a sea of marrows. In fact, I cure asthma patients by improving the kidney and the whole body, and the circulation get to the brain, and then they recall, and I cure them. Yeah. Anyway, okay. So if you have fear, and then you have any doubt, you can be a professional athlete. You know, when you want to hit the ball, there's no thinking. You just know when to hit. You want to strike a tennis ball into the court, okay? You should have no doubt. When you have doubt, you cannot have it. So right now, Dave hasn't been here for what 2014, almost a year.
Yeah.
Okay, so all this time, how is he performing now?
He got better towards the end, but he had that period in early 2014 where he was struggling, and that was a situation where I wish I could have flown him out here, to get a couple of treatments, but he did. He made it to the end of the season, but it's so important.
But he said he had ADHD.
Yes, so. He thinks he has. He thinks he's suffering from ADD.
Yes.
Because there is a family history. My middle son was diagnosed with ADD. I was diagnosed with adult ADD.
Right now they are over-diagnosing all these mental problems to put you guys on drugs. Okay, ADD is just some imbalance. You don't have any cooling power. The yin and yang are out of balance. Okay, so what if ADD? What can the regular medical profession, do for ADD? Give you drugs. Now, how is drugs going to improve your performance? Yeah. Not the way I improve it. No, here's your son in the beginning here. Shoulder problem, elbow problem, arm problem, neck problem, and breathing problem. And how did he, after 3 treatments, go back and hit a home run and bring in 2 hits? Yes. Okay, so that is really incredible. So yeah, I was telling you, if he would, before every game, you fly back here, get a couple of treatments, and every time you go back and hit a home run, okay, he'll be earning 30 million. Okay, it doesn't matter what the other people know. If you every time go back and hit home run, okay, and that's only the name of the game. He will. Okay. In fact, I am so much better than I was in 2009. Believe me, you probably notice the difference.
Oh, yes.
Yeah, that I can get you better. Whatever you tell me, I get you better right away. Okay, so I can get rid of not only the shoulder pain and give him strength, but also get rid of the fear. So he's confident. The kidney point, the Chinese call that the chamber of willpower. So your willpower is strong when your kidney is strong. So
I can remember even with my eyes, I had very dark around my eyes, and I don't have that anymore.
That means no, you still have a little bit, but not like before.
Yes.
You're like,
I was very, very dark.
You were like a Mexican panda.
I was. It was, and I had pictures of myself. And I do. It was very dark.
Yeah, maybe some panda blood in you. Anyway, here is your record. Then you go home. Okay, you match it and show it to Dave. Okay.
Yes.
Let's hope that we can convince him to come back. And I tell you, he get 2 or 3 treatments, he go back and he perform like a champ. Yeah. And then you can come back, fly back here when he's doubtful and feeling down, and perk him up.
Yes. That's definitely has to be done. And this is going to give me the opportunity to go back and, because I keep records of his games, and so I'll be able to match these up with his.
Okay, thanks very much. Okay.
Okay, thank you, doctor.
Okay.